Today I am going to discuss an interesting case of Paget's disease, the cone beam CT finding of a patient with a Paget's disease. Paget's disease is one of the commonest fibroosseous lesion. Here I am going to show you a case of isolated Paget's disease in mandible, which is not that common. Let's look into the radiologic features of Paget's disease mandible. So this is a panoramic reconstructed view showing cotton wool kind of appearance in the mandible around the roots of all mandibular teeth. So cotton wool appearance is diagnostic of Paget's disease. Let's move on to the 3D slices, and you could see abnormal enlargement of mandible. Overall the bone pattern is altered. You could see generalized hypercementosis of all the teeth. So let's move into the MPR slices. Let's move to the axial slice, where you would look into the mandible from the axial view. So Paget's disease has got three phases, like in any fibroosseous conditions. The initial phase is called as an osteolytic phase, where you would see bone loss, and we have a mixed stage. Finally we have an osteosclerotic stage, where you have a lot of fibrous bone formation. Overall the bone pattern in the mandible is altered. You can also see that there is abnormal enlargement of mandible, and in the coronal slices you can appreciate hypercementosis around the roots of all teeth. And since the mandible being more of a hypovascular area, you could also visualize multiple infections, especially in these axial slices. You could see a lot of infected areas turning into osteomyelitis. These areas are more prone for osteomyelitic changes. And another interesting thing with Paget's disease is one important lab investigation that is called as alkaline phosphatase level. Serum alkaline phosphatase level is abnormally high and elevated in patients with Paget's disease, which is an easy investigatory procedure which is diagnostic of Paget's disease. Stay tuned to Diagnox for many more interesting videos on cone beam CT, TMJ, pathologies, etc. Thank you.